Good morning, everyone, and welcome to the Thursday, November 18th, 2021 meeting of the Joint Boards of Health and Hospitals. So thank you everyone for attending. I would like to move for approval of the Zoom video from October 16th, 2021 to serve as the meetings from our last board meeting. May I have a motion to approve, please?
So moved.
Second. Any, all in favor?
Aye.
Aye. All right, we will accept the previous video as minutes for our previous meeting. And next on our agenda is Dr. Maddie for the COVID-19 update.
Good morning, everyone. So good to be here with everyone this morning. The sun is shining. I'm just going to tell myself the birds are chirping and we are all here today. I am looking forward to giving you this COVID-19 update and departmental updates later on in this agenda. So I will screen share if that is okay with everyone. Is everyone seeing the screens or
yes.
Is it flipped like last time?
Yes, see.
You gotta.
We can see it's not in speaker mode.
There we go.
That's right.
Is that it? Thank
Perfect.
you.
Yep. Got it.
Look at what a difference a month makes. So these are the COVID-19 data update as of November 14th, 2021. I want to uplift and give incredible credit to our Epidemiology Bureau that is headed by Dr. Moshe and specifically Matt Haslam, who has been responsible for the data for the city throughout this time, who has done phenomenal work, and for whom this presentation is reflected. So the daily case counts have declined significantly since the peak of the Delta wave that began in the summer. This downward trend has recently reversed though, with the 7-day average more than doubling. And I want to repeat that, more than doubling over the last month, from a low of 17 cases per day on October 19th to 39 cases per day on November 14th. The increase may in part be due to Halloween activities. So you know this, we've been talking about this throughout the pandemic. Consistently, we have seen that around major holidays, there are going to be increases in cases, and then with a little bit of a lag, hospitalization and a further lag, deaths. This is all consistent with what we've seen. So we know that Halloween activities 2 weeks ago may have attributed to this in part, and people may be spending more time indoors now with the cooler weather. So I will discuss this in detail when we talk about my director's updates with our departmental updates, but wanted to make that clear. So similar to the recent increase in case counts, percent positivity has begun to rapidly increase over the last 2 weeks. As you see here, we are seeing an increase of about, from the previous week of plus 2% for 6.2%. And then just to remind folks, and especially for folks who may be tuning in with us, that a high percent positivity indicates transmission and or a shortage of testing. The number of daily tests has remained largely the same. So we are fairly confident that that transmission is in fact increasing. Case counts are highest in the area with largest populations. Here I'm taking you through the COVID-19 cases by zip code. And we are seeing that these are highest with larger populations, and zip codes in the southwest part of the city also saw an increased rate per 100,000. So zip code 63109, 63116, 63111 have among the highest rates in the city after 63120, which had the highest case rate. This part of the city is primarily Caucasian, and the proportion of cases who identify as Caucasian has increased. And I'm going to discuss that in a little bit more detail on my next slide. So here we'll be talking about the COVID-19 case demographics specifically by race. So as we've discussed many times here over the past couple of months, African Americans have been disproportionately affected by COVID-19 throughout the pandemic. However, since May, there has been a trend, and I say a trend because we can't say anything more than that at this time, where Caucasians make a growing proportion of cases. So far, November has had the most equitable distribution with a 50-50 split between Caucasians and African American. So in thinking about why this may be the case, we can consider, number one, partially by the slow but continual improvement in vaccination rates in the African American community. And that is, again, to give credit to this incredible Department of Health staff who have really answered the call around equity, around addressing the disproportionate impact that we are seeing in this community. I am wary of saying anything definitive because we're seeing this for a month, but again, there is nothing to suggest that that trend is not consistent. This next slide has us looking at the COVID-19 case demographics by age. And what we see here is that the proportion of cases in those aged less than 20 has been steadily growing in 2021. Look at the orange and yellow bars. So in January, 1/10 of all new cases were less than 20 years of age, compared to September, where 1/3 of new cases were less than 20 years of age. Fortunately, the trend has leveled off, and now children age 5 to 11 are eligible for the vaccine, which will help to protect them from symptomatic infection. And I'll talk more about our rollout at the next slides. So the vaccine administration date, the 5 to 11 age range is now evident on the graph. So we will be able to report that to you since we now have the ability to provide vaccines per FDA, CDC, ACIP, and state recommendations. There's a sharp rise in vaccination initiation, which is highly encouraging. And again, I will speak to the overwhelmingly successful pediatric rollout that we had. Boosters continue to be administered at an increasing pace and make up a plurality of new doses being administered. Boosters are currently recommended for those at highest risk. But inclusion criteria may be broadened to any adult in the near future. And many of you may have seen in the news how New York is already doing that. I am reviewing our data to make the best decision for this city. I'm gonna let us just pause here because there's some numbers that are new to everyone, and I wanna give everyone the opportunity to take a look at this slide. So in this age group, we initiate, from the time we've initiated vaccination, we're looking at 171,706. Those who have completed vaccinations account for almost 150,000. And then the third doses or boosters, 21,628. But that initiated vaccine, the vaccine that I'm talking about in ages 5 and above, is 60.8%, extraordinarily reassuring to me, especially when we can compare that to national data. And for ages 12 and above, 65.4%. And for the completed vaccinations, again, comparable to what is happening nationally. So here we're looking at vaccination age 5 and above by geography. So geographic disparities remain, unfortunately, with zip codes in the Southwest having three-fourths of the population vaccinated compared to less than half in some of the northern zip codes. Zip code 63106 has among the lowest vaccination rates, but it also has the second fastest growth in vaccination initiation, with an increase of 5.1% over the last month. Again, something that I'm extraordinarily proud of in the month that I've been here, and is attributable to the great efforts of our health department staff. The zip code 63110 saw a sizable increase to the initiation rate over the past month and is now tied in the highest rate with 63109. So this slide will be looking at, and this is the final slide that I have, the vaccination initiation first doses by age group. So all 8 eligible age groups had roughly the same rate of vaccination per month in October. Children aged 12 to 17 have higher initiation rate than young adults aged 18 to 24. In younger children, 5 to 11 recently became eligible, as I said previously, and are beginning to show up in the data. And I gave you those rates. The vaccination rate for the pediatric population is expected to increase rapidly over the next few weeks. St. Louis City has the second highest pediatric vaccination rate in the state. And I am definitely going to end on that note because it's a powerful one. I look forward to tying that to our pediatric vaccine rollout that I announced almost 2 weeks ago, and to give further departmental updates. But I will stop at this time to take any questions or comments.
Do we have any questions from members or guests?
I have a
Dr.
question.
Booth,
Oh, sorry.
I was going to say Tim has his hand up.
Oh,
All right, Dr. McBride.
Dr. Mahdi, thanks. This is a very rich presentation and a lot of great data. It's very helpful. And I also want to applaud your staff for giving us this data. My question is, with the kids now being vaccinated, are we getting sufficient supply of vaccine?
That's an excellent question. When I arrived on October 18th, there had been no vaccine that had been ordered by the city. I then assessed the situation within the department to see if I should try to, in an emergency fashion, try to get vaccine, and if we had the capacity to do our independent clinical rollout. I made that assessment and spoke to my staff. I'd actually like to uplift our bureau chief, Justin Hauser, who has led these efforts throughout the pandemic. And what I did is, I think what any leader should do, right? Not make unilateral decisions, sit down with your staff, the ones that are on the ground, and get feedback prior to coming up with a strategic plan for a pediatric rollout. So I had some emergency meetings with the leadership of my team and required them to give me feedback from all of their different entities. I also spoke to my counterparts in the county, had meetings with the state, and also spoke to contacts within the White House COVID-19 task force and the CDC to make my final recommendations for a pediatric rollout. Based on that assessment, we have moved forward with a community-based equitable approach to a pediatric rollout that brings together partner entities who represent critical stakeholders within this unique pediatric populations. Those are the school leadership. I met in a matter of 3 days, did a whirlwind tour to secure partnerships for the city with all of our school leadership, with our 2 main hospital systems in SSM and in BJC, and also led by the FQHCs and community partners who also all agreed to join this unique and pioneer, never had before partnership, where we now bring together all of our clinical and non-clinical resources as a partnership to provide the clinics as they arise. An example of how that has already been fruitful is one of our aldermen, Alderman Shane Cohn, reached out to me directly and said that a Boys and Girls Club in his ward would like to provide a vaccine event. Because of the nature of this partnership, we were able to provide not only 1, but 3 events for his ward within 72 hours. And so that partnership works and provides us an equitable community-based approach to this effort.
Dr. Maddie, great presentation on great update. Do we know what percentage of the city of St. Louis has been vaccinated up to date? My guess is that we're over 50%. And given the rise in cases that we're seeing now, do you project any new restrictions going into the holidays?
So I don't want to give you a number that is inaccurate, so I'll provide you with the exact percent. I know that we have been within the 50 to 60% range consistently, but I will get you that exact figure here shortly. I have notes to the side. But to answer your second question, absolutely. This stark increase that in cases that we have seen in the last 2 weeks is one that I expect, that I do not foresee coming down. And if anything, I expect us to stay either steady or have further increases for multiple reasons that I would like to briefly discuss now. The first is the fact that, as I've said, we've always seen increases in cases, hospitalizations, and rates. and deaths around the major holidays, highest of which have been around Thanksgiving and Christmas. Second of all, we are entering the winter season, and with it, the inability for people to be able to be outdoors, where the ability to have adequate ventilation put people at increased risk and limit their ability to be socially distanced. So I have definite concerns that trend will continue. But moreover, I'm meeting with the pandemic task force, continuing to have those meetings that we have been convened, and that Dr. Clay Dunnigan has done a phenomenal job of leading and bringing us together. Because what we also saw around this time last year is how overwhelmed our hospitals were as a result, because of the other respiratory viruses, flu, and a plethora of others that put people at risk and that overwhelm our hospitals. So for me, the messaging starting next week prior to Thanksgiving and throughout the holiday season is key. It will be consistent, and our communications team has already begun those conversations. And then to answer your first question, the age for five and above vaccination rate is 60.8%.
Thanks. Well, 60% is a whole lot better. So
it's a whole lot better.
We'll take it.
And I believe will only be strengthened by the partnership, because really we should be leaning into and having a collaborative approach to this. Operating in silos only hurts our community. So it's something that I'm leaning very heavily into. Any other questions? Thank you. I will turn back to you, Dr. Ballou.
All right, so our next agenda item, we are moving into committee reports. So we will have reports from the Governance Committee, the Academic Public Health Collaborations Committee, and the Health Communications Committee. So Linda.
Yeah, good morning, everyone. On behalf of the Governance and Nominations Committee, I would like to present to you two nominees for your consideration for board membership for new terms to begin in 2022. We were very fortunate this year to have at least 4 exceptionally qualified candidates. We have only 2 slots available at the current time for our upcoming year. The candidates that we would like to present to you are Stephen Scott, who is currently the president of SSM Health St. Louis University Hospital. He has been in that position since January 1st, 2019. Those of you that have worked with the SLU community perhaps know him. Dr. Rhonda Ballou conducted a personal interview with him, and he is eager to serve. And I think we would be very fortunate to have him on our board. I know that several others of you on our board may have perhaps worked with him, but I think he would be certainly a fine addition. He has a public health background. He oversees over 2,000 employees at the hospital and is, of course, a major player in our city's hospital system. And I think his input would be really vital at this time, especially with all the COVID issues that we are facing. Our second candidate is a physician, Dr. Colleen McNicholas. She's the Chief Medical Officer at Planned Parenthood of the St. Louis region in Southwest Missouri. Dr. McNicholas is an OBGYN by training, and she is formerly a faculty member at the Washington University School of Medicine. She left that position, I think, 1 to 2 years ago to become Planned Parenthood's Chief Medical Officer. She serves she's a member of the LGBTQ community herself and has been involved in advocacy for LGBTQ issues for quite some time, as well as obviously a very strong advocate for women's healthcare issues throughout her career. She at Planned Parenthood, her caseload is made up of majority of underrepresented groups in our society, primarily young patients between the ages of 15 and 30. Planned Parenthood also sees a high number of patients who are receiving gender-related care, particularly gender-affirming or gender transition services. So I think she provides not only a vital role in our city's safety net health structure for younger patients between the ages of 15 and 30, but also is a vital role and voice for the LGBTQ community, which I personally would like to see some strong representation of here on our board. Her affiliation with Planned Parenthood elevates the role of sexual and reproductive health care for women, and it is very much a part of excellent and legal health care in our country, at least at this time, and that I would like to see our board support and would very much like to bring her on board. So we have these two candidates, Dr. McNicholas and Stephen Scott, which we would like to bring forward for your vote and approval. I believe that Tim has placed in the chat the announcement that SSM SLU Health posted for Mr. Scott. I call him Mr. Scott because I don't believe he's a physician. And then Dr. McNicholas, I don't know if we've circulated her CV, but I would be happy to post that in the chat if that would be helpful.
And Mr. Scott did interview him. He specifically told me that he had been looking for opportunities and ways to collaborate with the health department to assist with the pandemic and other health issues in St. Louis City.
Great. I'm happy to open.
I would move approval of the nomination committee's endorsement of Stephen Scott and Dr. McNicholas, contingent upon mayoral approval.
Thank you, Dr. Ross. Do we have, are we ready for a second, or do we have any discussion, or does anybody have any additional questions?
Second.
Thank you, Dr. Giuffre. May we have a vote? And all in favor, please?
Aye.
Aye.
All right.
Wonderful. Any opposed? Great. So moved. We have two new incoming board members. And
Delighted to hear. Thank you very much
Yes.
to all of our board members for supporting those nominations. We're really, really excited to bring these new candidates on board and really appreciate your support. Thank you very much.
When
thank you.
will they
And
be?
I'd like,
Oh, I'm sorry. When will they be notified?
We will, I'm happy to reach out to both candidates. Dr. Ballou, would you prefer to reach out to the candidates or would you like me to do so?
either is fine. I can reach out to Dr. Scott, to Mr. Scott, because I've been in communication with him. If you would like to reach out to the other candidate, because you've been in communication with her and we could CC each other, I think that would be a good approach.
Absolutely. So I will plan to reach out to Dr. McNicholas today.
And I'll reach out to Mr. Scott as well. And I'd like to thank the governance committee for the work they've put into identify candidates and to interview and to vet them. It's much appreciated. Thank you very much.
Yes. You're welcome. And just to clarify, just so the board knows, we do personally interview or via Zoom nowadays, every candidate that is brought forward. And I do wanted to tell the board, we did have 2 other candidates that were extremely attractive. We have a number of board members whose terms are due for either renewal or expiration in 2023. I think we have 5 board members whose terms are up or eligible for renewal in 2023. So the 2 other nominees that we had, which we thought were extremely compelling, we would certainly want to consider in the next year. So thank you again for all of your support.
Linda, I have a question. Are there term limits on board members?
Yes, there are. So we revised our bylaws approximately 2 years ago. We decided that we will now each serve 4-year terms, and we have a term limit of 2 terms. So each board member can serve a maximum of 8 years.
Thank you.
Our one exception to that rule has been our esteemed Dr. Ross, who has now served for more than 2 terms, but he is grandfathered in, and we may need to waive those limits to allow him to continue. But I think in gratitude for his many years of extended service as our board chair, we would all be happy to do so. But for the rest of them, and certainly going forward, we would like to adhere to our 2-term limit.
Thanks.
Well, any other questions or comments about governance committee activities or about our new candidates? All right, thank you. We will move to the next agenda item, which would be Craig, the Academic Public Health Collaborations Committee. Any updates?
Yes, we were very excited to host for about 40 Master of Public Health and bachelor degree students from St. Louis University on November the 5th. This was the first time that we had a live audience, so to speak, and our staff, our great staff that Dr. Mahdi already talked about, really stepped up to the opportunity, and we could have gone on, I think, for 2 or 3 days, except that there are parking limitations within the city of St. Louis, and so we had to kind of limit that a bit. But it was the first time since 2019, I believe, that we had this opportunity. And I really want to shout out to our partners at the St. Louis Development Corporation. Mr. Hauser will appreciate this. Our former boardroom area that we had on the east side of our offices is now being used mostly to store many of the materials that we need in order to do many of the vaccination clinics that we have. And so we were able to use the great boardroom that St. Louis Development Corporation has on the 2nd floor of our building. That allowed us to very easily, with great ventilation and lots of space, and all folks being masked. And as I understand it, St. Louis University, for the most part, is 100% vaccinated as well. We were able to pull this off. And so this is part of the academic health department that we have. And so there's like a 3-part series. We began with a general overview of the academic health department, then with this visit to the city, and then they will have either a personal visit or a virtual visit to St. Louis County. We are also, as I understand it, Dr. Moshe has talked about the fact that we have a number of partnerships and activities going on with Washington University for data sharing, and that is part of the Regional Data Alliance. So we probably should stay tuned for more of those efforts as well. With the academic health department, there's a lot of work around our workforce development plans, and I know that Rhonda Bartow is keeping us on track with regard to those. She's not a miracle worker, but she is relying on staff as we move forward. It appears that within the next year or so, we will need to have basically 2 workforce development plans that will include our learning agenda. We will be looking at the various competencies that are established and working through some of those, as well as, our workforce development is very important as part of our strategic plan. And in this time of COVID, where we also need to focus on the continuing other efforts that include racial equity and other equities that we've spoken about today with regard to the way we deliver public health services, this is of utmost importance. And so as part of that, the Academic Health Department has assured us and has committed to really giving a full court press so that we have the faculty support and student support so that we can do some of these surveys of our staff and also help with the development of the workforce development plan. Janine Arraghi is part of that. That may be a name who is familiar to you. She was a part of the family of our health department and continues working as part of this effort as well. Thank you.
Thank you, Craig. Any questions or comments about our academic health department and health department academic collaborations? All right, thank you for that report, Craig. Health Communications Committee.
Good morning. We have not formally met since last meeting, but we have talked about the survey response, our community citizen survey, to get some feedback on, issues of most importance for the communication team and the staff and us as board members to support in the next year. And a shout out to Matt Haslam and Harold Bailey and Kim Vandenberg for working on this, and others who I'm not attributing, but I know have been working. We have 350 completed surveys as of today, and Matt did a phenomenal job, I'm afraid maybe in the middle of the night last night, to identify which zip codes we are underrepresented in so far. I'm going to confer with Harold and Kim after this meeting, but I'd like you all to help us identify contacts in 9 zip codes where my target is to get up to 25 responses in these zip codes. And some of them we only need like 11 more responses. But if we could have a push for the next 10 days or so, in a conversation with Dr. Mahdi and with Harold and Kim, we've had agreement that we need to cut this off because we need to, prepare our 2022 communication program. But I think I'm going to volunteer to walk or drive to contacts in these zip codes and give them either paper surveys and or explain how to use the QR code so that in the next 10 days or so we can get a more equitable distribution of responses from the north side as well as the south side, which very generally, is where we need some more input from people. And also, I've been on the weekly calls with STL TV that our public information staff has to direct, most specifically, the phenomenal campaign for pediatric vaccination that Dr. Mahdi talked about. That with great creative and great collaborations, as she said, we are best in the nation probably with pediatric vaccinations per 100,000. And I'm so happy to be part of this. So anyway, I think you will be hearing an email from me. I have to confer with the staff first before I do anything, dumb or out of protocol. But I need to get some names of folks to call and ask permission to have them help us get some more input from their people in their zip codes or in their wards. So thank you very much. Any questions about that?
Questions or comments? And I will just a reminder that the Board of Alders Health and Communications Committee is also on deck and been receptive and helpful in being willing to help the Communications Committee follow up with focus groups and to explore some more issues related to perceptions of the health department and to identify individuals to help respond to the results of the quantitative survey. So they've been very helpful and have allowed the Communications Committee to present on the health and safety the Health and Safety Committee meetings. So thank you to
So-
them. I know it's out there.
Great point. So I think we'll digest the survey results in December, and then we'll be ready to figure out our focus group schedule, which we all know that focus groups take a little planning and work to get together and have them work and have good questions, and then, you know, do digestion and synthesis and an action plan. But with the team we have, I have no doubt that we'll be able to march through those focus groups probably, you know, at least in the first half of the year when we're talking about, you know, specific wards. We'll have to figure out how many we're going to have, but we could at least do each of the 4 quadrants in the city, get input from people. But what we want to do, as Dr. Blue said, is get our overall results and decide as a group what are the most important questions to discuss with people in dialogue, as opposed to a survey where we have set questions. So I think that's going to be very exciting to do next year. Thank you.
Any last comments, questions? All right. So next, we're back to Dr. Mahdi for departmental updates.
Hello, me again. So I would like to start with my director level updates, and then we'll go into our major bureaus. So I had given you a brief overview as part of a question to the pediatric rollout plan. I think everyone is clear on my decision-making behind this approach. And it really aligns with Dr. Ballou and Dr. McBride brought to me around the priorities we have around centering equity in all we do here. And so that community-based approach is something I'm extraordinarily proud of. And that is beautiful because when we talk about COVID, we've been very reactionary to this point because we've had to. I am now looking forward to the long-term new normal that COVID will still be a part of. I hope in a much less significant fashion, but realistically so. And so utilizing sustainable measures and blueprints that will help us in that new normal, and blueprints that can be applied to our non-COVID related health issues, which are also a priority for me at this time. So to flesh out that pediatric rollout a little bit more, the central tenets of it are twofold. 1, providing vaccination to families, and 2, ensuring that we have culturally competent, accessible education at every step of the way. To that extent, I have also convened a work group that will also represent significant stakeholders to provide a forum bi-weekly for feedback, accountability, and shared resources. The different groups that that are represented in this work group, whose first meeting will be scheduled for when we all return from Thanksgiving and will be meeting bi-weekly, include the Board of representatives from the Board of Aldermen, all of the leadership from our FQHCs, a representative from our grassroots community partners that are oftentimes left behind in these conversations, representatives from our clergy advisory board, representatives from all of our main school leadership, representatives from our immigrant and migrant communities who are again often left behind and for whom I will be talking about some of my initiatives later on in this report, representatives from my staff and from the mayor's office, as well as the general public. Another initiative that I have implemented is, again, in line with education, have been working tirelessly with our PIOs, Harold Bailey and Kim Vandenberg, who have been working tirelessly since I came up to elevate the level of how we've been doing communications. We have seen over 30% increase in engagement on our social media platforms since I have come into this position. We have also been having a really successful partnership with the press to ensure that we are providing culturally competent information about what we are doing here at the health department. So to further that, we will also be holding our first town hall that I'm so excited to share with you. After this meeting, I'll be sending an email to Dr. Ballou to please send to all board members so that you can utilize your networks to really make sure that the public knows that they can convene with us. The purpose of this first of many town halls, I hope, is for us to specifically address the pediatric rollout and engage the community. This is a time for us to be able to teach people in accessible language. Our great commissioner, Dr. Fred Eccles, will be giving a COVID-19 update in an accessible way to the general public. He will also be explaining to them in a way that they can digest the reasoning behind the data that we was used for this recommendation. But the bulk of this time, I've dedicated over an hour of this time to a fireside chat with our constituents so that they can really have a Q&A. Having said that, I am mindful of safe spaces for people to communicate. So our PIOs have really taken the lead in partnering with our great STL TV that has worked tirelessly with us to make sure that we have a diversity of excellent high-level communications materials. They and our PIOs will be on hand to make sure that we keep our chat rooms and the line of questioning and the way that we dialogue respectful throughout this virtual time. So I am so pleased that we will be doing this, and if the public wants it, we will be moving forward. Lastly, in all of my meetings with our partners, I have made myself personally available for webinars, for meetings with parents at our individual schools and within the community, to our Board of Aldermen, who I now provide a weekly COVID-19 and Board of Health update that comes directly from our office and directly from me specifically weekly. And it is because of that communication that I've gotten direct feedback and been able to respond to the needs of wards, especially those most marginalized. After meeting with our staff, we have come together and put together a unified mission, values, and goals statement that we will be displaying on our website, and I will be sending a link out for everyone to see. I think it's important when you get new leadership to really engage with the staff and make sure that they are a part of my missions, my goals, and our values, and that our unified approach is how we move forward. Additionally, I have asked for reports from all of my bureaus and section chiefs and have compiled a report that I will be giving to the mayor's office so that she is aware of where we are since up until the time that I came. I will be using that report in addition to my own expertise to then move forward with being able to provide you with a strategic plan for the remainder of both of our COVID and non-COVID initiatives. So looking forward to getting that back to you. Some key things that have also happened since I started in my tenure is we have been focused very much on increasing capacity and increasing the value experience for our staff here. Dr. Eccles has been working tirelessly to address those within our staff. Him and I have met with the head of personnel here, who have been extraordinarily supportive in wanting to help us bridge this divide that can be sometimes difficult to do when there's legislative processes in place that must be adhered to and that are that have been difficult to adapt to make changes to in the speed that is required to meet our demand. So Dr. Eccles has been working tirelessly to do that. And since our last meeting where I gave you that really difficult statistic of an N of 1 for our animal control section, has since brought on 2 new individuals. Thank you to Dr. Eccles, we're so happy, who are going to be onboarded and trained. And it is his efforts to continue to do that. I am in continued conversations with Director Rick Frank, who has graciously been working with me to find other innovative strategies to help until more long-term strategies can be put in play. We had our first monthly meeting with the county leadership. I told you this was one of my first initiatives since coming into this position. Dr. Ballou joined us, Dr. McBride. We have made sure that those invitations have been made available to Dr. Ross, who I hope I don't embarrass him by saying this, I think is the premier person who has been in leadership capacities, not only in our academic systems, but in the city and the county, and can join those meetings to help us really move together this collaborative approach. One of the things I'm most proud of and put on my agenda, now that I don't have the luxury of calling myself a rookie anymore and people are looking for results, is in speaking to the leadership of our partner in the pediatric sector. We know that the difference in quarantine requirements for children in our schools has made it very difficult for parents and for leaders when children and families from the city and the county have had different expectations. I have reviewed those and we will be moving forward with trying to standardize those as much as possible. And I hope to have an update for you with that. And I'd like to thank our partners in the county for assisting us with that. I'd also like to thank my contacts at the White House Task Force and the CDC for also getting us data that can empower us to be able to make the best decision for our city. I will move now to some of our bureau updates, beginning with environmental health services. So for COVID updates, upcoming vaccination clinics, we have this weekend at Unity Chapel Church and Better Life Family. Emergency preparedness team is supporting with partners agencies with pediatric COVID vaccination clinics, and PPE distribution and clergy coalition kit distribution is still underway. The priorities at this time is filling vacancies, 7 animal control officers, 2 inspectors, 1 community sanitation inspector, 1 pest control worker, community sanitation supervisor, emergency preparedness program manager, environmental health services program manager, and a front desk clerk typist. I made it a point to actually read that list out to you because it should be in the forefront of your mind when you hear all of the positive updates I'm giving you, just how much work is being done when we still have so much to fill by way of our vacancies. Many thanks to Justin Hauser for his leadership. We are updating online access to food permit applications and also transferring departmental knowledge into written processes to help reduce the impact of staff turnover. Some of the challenges that we are addressing. So the recent staff turnover in key leadership and historical knowledge positions has disrupted the day-to-day operations of the Environmental Health Bureau. Additionally, fatigue from the aggressive vaccination tempo and duration, along with the satisfying routine inspections and complaint investigations, has honestly reduced staff morale and enthusiasm as we enter into the next wave of intense operations supporting the pediatric vaccination campaign. For that reason, I've been having now weekly meetings with the leadership. I've asked staff, we have rolled out a survey to staff to ask them what we can do to better support them. And I have recently been in communications with our director of the head of budget. Forgive me for not using the proper terminology. The legislative process in the city is one I'm still becoming accustomed to. But Craig, you can help me out. What is the correct way that I'm supposed to address Mr. Payne?
Budget director.
Thank you, budget director. I was almost there, right, Craig? Budget director and I have been in communications about additional funds we can use that have not previously been able to be utilized to help with staff morale and small but significant things we can do throughout our time to increase their experience here at the health department. Updates from our Epidemiology Bureau. The Community Health Assessment and Community Health Improvement Plan is something that we've partnered with St. Louis County for CHA in developing this plan. A contractor for professional assistance has been identified and the contract will commence on December 1st. CHA and CHIP are part of the Public Health Accreditation Board requirements for the DOH reaccreditation. CHA will help the DOH understand community priorities, challenges for improvement, and all this will be reflected in the CHIP, which is a strategic plan for our community partners who help with its implementation. We've also have embarked on a performance management plan. So the DOH is finalizing its performance management plan. The plan acts as an operational guide for our performance management system, which highlights the DOH program goals, priority areas, and performance measures for routine monitoring and evaluation of the programs. The plan will be shared with the board at the beginning of July. Last but not least, our WCAH. I'm going to ask Candace, you always help me with this. So women, child, and adolescent health.
Correct. Excellent.
Updates.
Mm-hmm.
Come on, man, a month in, we're doing it over here. So the CARS project is entering year 2, completed its first evaluation. We had a CAB retreat last weekend. The CDC is interviewing all on DOH staff and Williams Association staff on the project. Our Fast Track Cities St. Louis initiative is preparing for World AIDS Day and the 3rd anniversary with a That's What Friends Are For theme. And we'll be asking for nominations from an individual or agency whose efforts have been essential to the progress that they have made over the so far in the journey ahead. We've submitted a 3rd quarter lead report for the WCAH, refining our list for SLPS and lead clinics, and hoping to release our resiliency booklet soon, awaiting final clearance. We are entering the Epidemic Grant. Ending the Epidemic Grant is off to a great start. the team has been assessing what's currently happening with HIV prevention within the DOH and region and aligning it to the core strategies, discussing what we desire to need to make an impact in the community and help increase HIV and STI testing. This will drive how we move forward with disruptively innovative methods to end the epidemic in our region. So there are multiple ways that this is happening. A Take Me Home program that will go live on HIV on World AIDS Day. A new PrEP clinic operating out of St. Mary's Hospital that can provide a direct linkage to PrEP from HealthStock, ensuring community members are connected to PrEP. Truly revolutionary. HIV testing, we're building more partnerships in the community and really ramping up our social media postings to promote self-testing, PrEP and PEP, HIV prevention, etc. A TB and Refuge Clinic is administering COVID-19 vaccines to refugees at the International Institute. I cannot underscore how important this is. 77 medical screenings were provided to refugees in October, and the International Institute is receiving 126 Afghan refugees as of yesterday. And lastly, in our grants administration, we submitted our FY22 grant submission with a budget limit of just over 6.5 million. The grant period is March 1 through February 28th or 29th respectfully, and this year 29. And I'm very pleased to make these departmental reports to you, and we'll stop now for any questions or comments.
Dr. Marty, I just have a little comment. I just want to acknowledge the hard work that Candace put through in creating the retreat space for her staff that you, both you and Dr. Eccles attended. So I'll let you take it from here if you want to tell the board a little bit more about that, but I definitely wanted to acknowledge the hard work that she put in to provide that to her staff.
Dr. Mahdi, if you want to say a couple of words because you attended, but I thought it was really phenomenal. We used an evidence-based framework, Joy in Work, and it was very well received by staff. And I will be working with Rhonda to put this together as a QI project, addressing specifically staff burnout and low morale. So I just want to say thank you so much to the leadership, both the support of Dr. Mahdi, Dr. Eccles, and of course, Ms. Franda. When I brought the idea to her, we started planning this in the summer when we really pushed through to have a phenomenal event. We had one speaker from SLU, a nurse, talk about diversity, inclusion, and equity, and how we can use that as a pillar to drive high-performing teams. We had someone from the Conflict Resolution Center because we want to make sure that conflict is productive in terms of resolving conflict. And then lastly, we had one of our nurses, Nurse Gwen Thompson, who's been with the City Health Department for close to 3 decades, talk about building resiliency among our team. So really pleased with the result and hoping that this can be utilized across other sections and bureaus.
And just want to again say to Candace, her leadership in putting this together was incredible. She reached out to our partners at the Deaconess Foundation. Many thanks to Bethany and her team for supporting us. That space, just being able to take them to a space where there's open light, beautiful windows and scenery, get them out of this space and provide them a safe space to really reflect and talk about what resiliency means to them. When I came to talk to the staff, we went around in the round table and really shared, and they were super transparent in sharing their experiences. Those types of opportunity, while they may seem small, are significant to building morale, getting feedback, and ensuring that we give the staff the value that's needed. And that was due to the leadership of Candace, Franda, and their teams. Thank you so much. Any other comments or questions? All right, that's it for me, folks. Oh, actually, one thing. Dr. Eccles had posed a question, Dr. Ross had posed a question at the last meeting around the ARPA budget and had followed up with an extraordinarily helpful email to me. I'd like to address that briefly, but say that I will follow up with the agenda, a dedicated presentation dedicated to that. I plan to do it at this meeting, but I actually held off, and this is why. I have had time now to address to look in detail with the ARPA budget, and directly in response to Dr. Ross's question at the last board meeting and the email that he followed up with, did meet with the mayor's office to discuss in detail what is happening around those appropriations. There's a recording for the HUD's committee that I would refer folks to this committee from, where we were able to present that budget in a line item and provide details as to what has been allocated. However, the reason why I didn't bring it to this board on this month is because I have made the determination that due to the current state of the health department and the current needs that the response to COVID requires, I am looking into a review of this budget as it stands, and have met with council and the mayor's office as to what options are available, if amendments or other revenue streams need to be addressed that reflect the priorities as I have assessed them at this time. Because of how preliminary we are in those talks, I think it would be better, because we will have made a lot of traction on that by the next Board of Health meeting. I will dedicate a presentation to that, and just wanted to address Dr. Ross directly to make sure, but also wanted to make it very clear to everyone that the publicly available recording from the last HUD's committee meeting gave an update from the mayor's office, my office, and Dr. Yusuf's office around the very questions that you asked, Dr. Ross. Just wanted to make sure that that was a reasonable path forward for you, Dr. Ross, and take any other questions around the ARPA budget that I can answer at this time.
I agree entirely with your approach, Dr. Maddie. Thanks.
Thank you.
Any other questions or comments? All right, moving forward. Any old business? All right.
Can I bring something up real quick, Brenda?
Of course.
So I just want to bring something up for maybe discussion further in another meeting, and maybe put in a pitch on something. As you all know, hopefully you all know, Medicaid has been expanded in the state, and we are now enrolling people into the new adult expansion group. And in previous meetings last year or so, I made a presentation on this. This has been a topic I've been working on for 16 years, as it turns out. I just wanted to let you know that as of this week, 16,424 people have signed up for Medicaid expansion in the state. And so we need to sign more people up, but we, in our Center for Health Economics and Policy, we're following these numbers closely under a grant for the Missouri Foundation for Health. And we're waiting to get the full data on this, including county level data. Once we get that, which we think we'll get at the end of this week, we'll be launching a dashboard, which will probably go live either later this week or early next week, which will have data at the county level on the number of applications and the number of people enrolling, which I could send out to the board if you want. And if you want to hear more about it at the next meeting, I'll probably know a lot more about what's going on with the expansion. But, you know, I know this is not directly related to public health, but it seems somewhat related to public health. So, because it'll affect people's access to healthcare. So I'd be happy to share this with the board if you're interested.
Tim, is there a campaign, maybe Missouri Foundation for Health is doing this, to help people understand, who's eligible to sign up and to help them sign up? And is
Yes.
it statewide, or is privately funded, publicly funded?
Yes, the Missouri Foundation for Health with some have paid for partners to do messaging on this. So I'd be happy to share access to their page. So if you wanted to put some of their on your social media and your own pages, some of their communication, which will allow you to describe to individuals, and they have a whole toolkit that talks, it goes on for about 20 pages to how you can message this to various groups of, and they've thought through about how to message this to people, Latinos to LGBT groups to African Americans to, you know, whatever group, they've thought through a lot of the different, how to reach difficult, you know, not difficult, but, you know, to think about reaching everybody we can possibly reach, because, you know, they're the ones who are leading this effort and they're working with advocacy groups. I get on probably three phone calls a week talking about this stuff. So
Yes.
I'd be
you
happy
can
to
send
share
it-
that document with you as well, Lisa. You're the communications person, so you're probably a good person. And I can say the website too.
Yeah, well, our committee can look at it and see what we think, and all our public information officer huddles too. But that's one way we're going to move forward. So thank you very much for sharing that.
Okay, sure.
Dr. McBride, do you need a few minutes at the next meeting for any updates? Do you have any other stats or anything that could be helpful, or even perhaps January, since December will be kind of the last meeting of the year? Do you need any? Is there anything?
I certainly will have, sorry to talk over you. I certainly will have more stats by next meeting. We have some stats right now, but it's kind of incomplete at this point. But our dashboard is kind of ready to go once we think we'll get more stats by the end of the week, and then we'll be able to show you data on county by county where the applications are coming in, which managed care plans are going into, and you know, a few other things. We'll show you what we know.
All right, would a 10-minute slot be helpful?
Absolutely. Whatever time you have, I will fit it.
Okay, I will work with Dr. Mahdi on adding that as an agenda item.
Thank you.
We have to set the clock timer.
Oh yeah, you know I can talk. I'm Irish, so.
Okay, we will work on that for the next meeting. Okay. Any other announcements?
Can I ask Tim a question?
Of course.
Okay. Tim, on your data,
You muted
I don't know if
yourself.
I'm framing, yeah, I know, hit the wrong button. I don't know if I'm framing this correctly, but is there a way, as you're collecting data on who is getting, who is signing up, is there a way to capture those people who are uninsured but fall into the gap and don't qualify for expansion? Because we know we're still going to have some populations, although obviously the numbers won't be as large. I'm thinking specifically about postpartum women who may not qualify for Medicaid, but also don't qualify for the marketplace. And it seems to me, although I'm not as well versed in this, that there might be a group of the population that is going into Medicare that for some reason may need Medicaid also, but may not qualify. So I'm wondering if there's a way to capture those populations, because while I think it's wonderful that we have expanded Medicaid, there are still populations that are going to be left out, and I don't think we can forget them.
Well, we've actually talked about that group quite a bit. So as you may know, the state enrollment in Medicaid has increased by 200,000 during the pandemic, and the enrollment in pregnant women has tripled. And it's because women who become pregnant are eligible pre and postpartum, but the CMS does not allow you to disenroll them
Right.
While they're in the pandemic. But once the pandemic national health emergency ends, they're going to start disenrolling them. The good news is the state is the first group they're going to reach out to actually automatically put them onto Medicaid, as long as they're below 138% of poverty, is those women who are below 138% of poverty who are currently postpartum. So that group is being taken care of. So, and they're doing it manually. Welcome to Missouri. So it's taking a while. That's why our number is only 16,424. Oklahoma's already enrolled 200,000 people. So So anyways, so there should be no reason why anybody below 138% of poverty is not enrolled as long as they're a citizen. So just send that message out to people.
Yeah, right. Right. I'm more concerned about those that are above 138.
Yeah, yes.
Yeah.
They should be eligible
Capture
for the
that
market.
data as well.
They should be eligible for the marketplace.
Thank you.
All right, any other questions or comments about Medicaid expansion? And we will carve out a brief report time for Dr. McBride next meeting to give us some information about Medicaid data and Medicaid expansion data and updates. And hopefully we could have some discussions about the role of public health and community health and existing health department relationships, as Dr. Mahdi has assembled a number of pretty powerful community groups related to COVID and other health conditions, and how can those groups be leveraged to make sure that we are getting all of those who are eligible for Medicaid into the program. So we'll look forward to a discussion on that. Any other questions or comments or other announcements?
I'd just like to add, tie the Medicaid expansion to a somber number that we got recently about opioid overdoses in the country. You might have seen on the news that for the first time, we've now had 100,000 opioid overdose deaths in 1 year. And that's a 28% increase from last year. So although the opioid epidemic is a bit under the shadow of the COVID epidemic that has taken several times more lives, sadly, the opioid epidemic is alive and well and continues to grow, and disproportionately affects the city and disproportionately affects minorities. And Medicaid expansion is a fantastic advance in trying to provide services to this population, which in a significant amount of them were totally uninsured. So that's great news for trying to fight this epidemic.
Important point.
Thank you, Dr. Yu, for that information. And we will, make sure that I know, well, Dr. Mahdi and Dr. Eccles also make sure that although COVID is critically important, that we are not losing track, or we will not fail to pay attention to all of the other co-occurring epidemics that we have, including violence and opioid addiction and maternal child health issues that we have going on in our city that also deserve our attention and that predated the pandemic. So lots of work to do. Any other questions or comments? All right.
I have a question. If there are specific topics that you would like to see presentations from the health department, I'd like to start adding those to the agenda. A few that come to mind, obviously, is the ARPA dollar discussion that I discussed earlier. Cure violence report from Dr. Eccles, who I've asked to stay on in a leadership capacity overseeing that. But if there are any specific topics people would like to hear from me, feel free to either say now or email me directly so that I can put those in queue and make sure that the representative leaders have an opportunity to uplift their work.
Dr. Mahdi, I'd be interested in hearing something a little more detailed at whatever time you believe is appropriate regarding the department's STI and PrEP related work. I know you did mention that. You always
there's so many things there, and I always have to cut off my updates when I give them to you from that section, Linda. So I think it's a phenomenal idea. And I'm sure Franda and her team would be more than happy to accommodate. So we'll put that on the list as well. Anything else?
Thank you.
Thanks, everyone. Please feel free to email me directly.
All right, so we are winding down. A couple of other announcements. Our next board meeting will be December 16th. Same time, same place, 8 a.m. via Zoom. And also, we will discuss a little bit of further. I will actually be moving out of state, and you will have a new board chair, and that's going to be up for discussion. And we will talk about that a little bit more. We don't have any details right now. And I will continue to work until then, but we will discuss that a little bit more at our next meeting.
Well, because I know that is a difficult space for you is to be the center of attention, Dr. Ballou. You're one of the most humble servant leaders that I've ever had the opportunity to work alongside. I will start by saying, from the moment that you told me this, I had such difficulty in how selfish I felt about this loss for us and for the region. I'm thankful that you will be staying on in a limited capacity. And I have to be a better friend, a better colleague, a better partner in leading with true excitement for this extraordinary leadership position you are walking into. It reflects the years of servant leadership that you have provided, not only this city, but this region. And our loss is their gain. But I just wanted to congratulate you, to thank you, and to tell you that we are extraordinarily happy for you and proud of you. So thank you so much, Dr. Ballou.
Dr. Mahdi, we can just stop moving trucks. We don't have to be that gracious.
Amen.
The rest of us can just be selfish.
We'll leave the grace to Maddie, which she does extremely well. And we are grateful for that. Thank you, Dr. Mahdi. But we will talk. We're buzzing behind the scenes, making sure things get done. And I will be around here. I'm going to have to shout out Dr. Eccles and Dr. Mahdi. We've been working with Better Family Life and some community-based organizations on getting vaccinations to vaccine hesitant communities, mostly in North City and the northern part of the city. And I will be back and forth through next July, continuing to work on that with the team. And they have graciously allowed one of my students to sit 20 hours a week with the pandemic response team to make sure that we're trying to get some shots in arms. And as I've mentioned before, we do have a website that's focused on African-American vaccine communication. And we have training. We're going to be doing another training, and I will invite anybody on that's in attendance today. We're doing a training on Zoom next week on culturally responsive and culturally grounded COVID vaccine communications. And if you are interested, please email me, and we can invite you to. It's targeted towards community partners and anybody that does community engaged work, but how to communicate about COVID vaccination, especially to those who might be vaccine hesitant. So more to come, but you are not completely getting rid of me yet. All right, so we will talk more next month, and we'll also ramp up and get ready for our new board members that will come on in January. So we've been communicating with them, and I will move that we adjourn, and we will have about 13, 14 minutes left of your schedule to return to you today to do more of the phenomenal public health work that we are all doing here. So
thank you, Rhonda.
All right, folks, I will see you December 16th. And we'll be in communication in the interim. All right, have a great rest of the day.
Thank you very much, Rhonda, for your service, but we'll see you one more time.
Yes, you will see me.
Forever.
Thanks, Rhonda.
Bye.